Hello, and welcome to Health Matters. My name is Larry Williams, and I'm your host. This program is devoted to discussing health issues and health initiatives related to our people of color population. Today, our guest is Dr. Kirk Dombrowski, and he's of the Minority Health Disparities Initiative at the University of Nebraska-Lincoln. And I want to welcome Dr. Dombrowski to our program today.
Thank you for having me, Larry.
This was a program I really didn't know anything about, so I'm really excited to kind of discuss that and share it with our audience today. Great. But I think before we get into the nitty-gritty, it would be kind of nice to know a little bit about you and your background. Sure. And where you're from and what brought you to Nebraska.
I'm originally from Massachusetts, but for the last 25 years I've lived in New York City. I did my graduate work, doctoral work there on substance use and suicide issues among Alaskan Natives. And then in the 1990s, I began working on HIV issues. That was the time when HIV was ravishing cities across the country. And if you were interested in health, you were interested in HIV. Mm-hmm. And then I started doing some consulting for larger projects, and one of them was with the university here with Professor Les Whitbeck, who was a very well-known Native American minority health researcher. And when he was retiring, he said, "Why don't you come and take my job?" And I said, "I don't, am I ready to move to Nebraska?" But mm-hmm. The university made a tremendous pitch. It turned out to be a really great place to work, and I wound up at Nebraska.
And how long have you been here now?
About 18 months.
18 months, okay. Well, why don't you tell us, what is the Minority Health Disparities Initiative? What is it all about? What does that mean?
Yep. So the Minority Health Disparities Initiative was begun about 3 years ago at UNL. And its main task originally was to enhance faculty research around issues related to minority health and health disparities. And it's a broad-based sort of coalition. Faculty aren't paid to be involved. We bring them in and we support their research. And we try and generate research projects out of that. But we've expanded it since I came in to include a couple of other aspects in following the sort of broad outlines laid out by the National Institute of Health's Institute for Minority Health and Health Disparities. And that means that in addition to research, we've added programs in graduate education that are trying to educate and create the next generation of minority health researchers, and also to broaden the participation of historically underrepresented groups in health research more generally. And so we've added programs in a number of these areas to try and now have a sort of threefold mission: research, training, and broadening participation.
Okay, all right. You kind of touched upon this, but what other departments within the university and professors and university faculty members are participating in this initiative? Because you said it's a broad spectrum.
That's right. And so we've had great luck in that we've been able to draw on a lot of existing strengths at UNL. As you might imagine, it's a big university with a lot of faculty members and a lot of different things going on. And so one of the pleasures of being the sort of faculty coordinator is I got to reach out to people who may have been operating in departments all over, fairly in isolation, and showing them that they had a whole community of researchers there. So we have 2 faculty affiliates from the College of Education and Human Sciences. We have a brand new faculty member who just came in the Department of Nutrition, which is over at the College of Agriculture and Natural Resources. We have people from the Psychology Department, faculty from Sociology, Education from the Center for Brains, Biology, and Behavior. So we have, I think, in total about 15 faculty affiliates, and they represent 7 colleges and 6 departments, or six colleges, 7 departments.
Okay, okay.
Yeah.
So kind of explain, sort of as you're the chair or the head of this, what do you do on a daily basis and how does it operate?
Well, it changes. My day-to-day routine in the initiative changes quite a bit depending upon what we're up to at the time. So we do a lot of faculty grant support, and that means that when faculty have an idea for a research project, we help them figure out how to bring it in, implement it, what it's going to cost, how many people they need, what external contracts that they might need, and so on. And that tends to follow the National Institute of Health deadlines. So So we're really busy right around June 5th and October 5th and January or February 5th, depending upon which program people are in. This time of year, right now, most of the grant stuff is in and done. We're gearing up for our REU, which is a research experience for undergraduate program that's funded by the National Science Foundation. And that means that starting in about a week and a half, we'll have 10 undergraduates coming from universities all over the country that are interested in minority health research. And they will come and work with our team for 10 weeks this summer. And the National Science Foundation pays them a stipend and pays them their travel and so on, and meals and everything. And we get to work with them as the sort of next generation of health researchers, and they get to get a real health research experience even as undergraduates. Mm-hmm. We had 176 applications for 10 positions, for nationwide. So it was a very selective program, and we're really excited. These are great students.
Mm-hmm. And they're from all over the world?
They're from all over the country.
All over the country.
We have Puerto Rico. We have my own students I'll be working most closely with on the 10 students we shared out among a number of faculty, working all under sort of my supervision, but working directly with other faculty members. But the 3 who are working with me, San Diego, Puerto Rico, and Massachusetts. Okay. So all over.
Just kind of curious, what will some of the things be that these students will be working on this summer while they're here?
Yep. We have data collection going on right now on a project in minority health in Puerto Rico, and that's an HIV project. And so 2 of the students will be working with me directly on analyzing the data. Data collection will be finished, we're projecting June 5th. So this will be brand new health research data, hour-long interviews, several hundred participants in the study, and the students will be working with me on data analysis, on interpretation, authoring papers, as though they were budding graduate students.
Mm-hmm. Okay. Are there other or similar type of initiatives at other Big Ten schools or other universities throughout the country?
There are, quite a few. One of the things that sort of spawned this was that the federal tobacco settlement, where the federal government stepped in on behalf of 46 of the state's attorneys in the large tobacco settlement a number of years ago, dictated that a proportion of the settlement funds that came in each year had to be spent on health disparities research and on minority health. And so a lot of states didn't know what to do with that money. So they went to their local university and said, we would like to start a program for studying minority health disparities. Can you help us? And so UNL started one. There is an excellent one at University of Texas, El Paso. There is one at the Alabama Birmingham campus, mm-hmm. at their medical campus, Northwestern, University of Illinois Carbondale. There's a number of schools that that were on the receiving end of those funds and started up some very successful programs. So.
Okay. When I was reviewing your website, I saw a lot of topics and a lot of research papers that have been authored through this program, have come from this initiative. Maybe you can share with our audience some of the highlights and some of the things that you've researched and that you've presented information and topics and research on that would be of interest to our audience.
Sure. Well, our website has a number of resources from all over, so not just by our faculty, but by faculty from and researchers from across the country. And so part of it, if you go to the mhdi.unl.edu website, you'll see a resources section. And in that resources section, you can find information on a number of different things related to minority health, and they're all open access, public access. So in terms of our own faculty publications, we have a number of faculty working directly in Nebraska. So Professor Tim Nelson in the psychology department, Professor Bridget Gooseby in the sociology department are doing research here in Nebraska. And some of that that research is being published right now in academic journals. But we also, as part of the initiative, have hired a communications outreach director that's begun putting together some community resources that will be more directly approachable, less academic, and some of these appear on the website as well. And so those are on things like nutrition, chronic stress, obesity, mental health needs in rural areas. So these are a number of topics that people can find information on that's being produced locally. We are also, hopefully this summer, we'll put out our first edited volume, a book by the minority health researchers at UNL, and that will be available at a low-cost paperback price on Amazon, we're hoping by September. And that's in collaboration with the Department of Health and Human Services.
We've kind of talked on the academic side here, but I think it'd be really interesting and also very helpful for our audience if they kind of knew your efforts to do community outreach and to bring the community into what you're doing at the Minority Health Disparity Initiative, because that's how I got to know about the whole initiative, because I didn't even know it existed. And there's a real great effort for you to bring in the community, and I being at the Malone Community Center and then working with African Americans, the majority with our clients, that's how we were brought into the picture. So maybe you can kind of talk about that connection that's being made to bring the university research to the public and the community and being used.
Right, absolutely. This is a high priority. I think to do successful research on this topic, you have to have quality relationships with the people that you're doing research with. And so we adhere to a process of community consultation in general in our research. So when I got to the initiative, the steering committee was mainly made up of faculty because it was mainly research oriented. But there weren't a lot of people who had worked locally. And so one of the first things we did was to try and reorganize our steering committee, our oversight advisory board. And we figured we knew enough of what the faculty were looking for already. And so we limited the number of faculty on our advisory board, and we reached out to people like yourself and to Roger Garcia at El Centro, Anitra Warrior at the Indian Center. These are members of historically represented groups and institutions that have access and play an important role in those communities, and we thought that would help bring the perspective into the initiative that we were missing. As a part of that, we are now looking at how we can expand our events that have always been held at the university to begin holding events at places like the Malone Center, so that some of the research that's going on can make its way back to the communities in direct fashion. They don't have to read it. They don't have to wait for it to appear on a website or go looking for it. They can come to a place where they already know and are familiar with and hear the researchers talk directly, and they can ask questions and find out and let us know the kind of things that are pressing in their lives, because we hope to know, but we don't until we get there. We have some really great researchers that are really seriously committed to working with the community, whichever community their particular research topics take them to. And what they really are lacking at this point is the opportunity to do it. So if we can bridge that as an initiative and make those connections for them, we feel like we're creating a path for communication that can really be successful.
Okay. Well, thank you, Dr. Dombrowski. With that, we're going to take a short break, and we'll be back in a few minutes and continue our discussion with Dr. Kirk Dombrowski and the Minority Health Disparity Initiative at the University of Nebraska.
This is Max. 13 years from now, he'll try pot for the first time because he just wants to fit in. This is Katie. 12 years from now, she'll find a new group of friends and start skipping school. This is Aaron. 10 years from now, he'll be bullied by his classmates and become withdrawn. Raising kids is hard. It's okay to ask for advice. Call 888-866-8660 to speak to a trained counselor. Any problem, anytime.
Welcome back to Health Matters. My name is Larry Williams and I'm your host. And today we're visiting with Dr. Kirk Dombrowski about the Minority Health Disparity Initiative at the University of Nebraska-Lincoln. Let's continue with our conversation, Dr. Dombrowski. And one of the things that I noticed and I've learned is that the Health Initiative really tries to encourage more research. And maybe you can talk about what's being done in that area to encourage that type of research.
Sure. So in terms of the folks who work directly for the initiative, We have 2 postdocs right now. These are people who finished their doctorate and were hired from outside the university to come in and help us sort of establish some strategic planning and around health disparities issues. And they have been working with our Public Policy Institute on a number of programs to try and sort of figure out what the resources are at the university for minority health and to try and create a kind of unified or strategic direction for minority health research at UNL. And along those lines, we have an ad out right now. We're looking to hire a 3rd postdoc in Native American health. And hopefully we can get that person in place by middle of July, and they'll spend a year developing a strategic plan for research for the university so that we have researchers doing complementary kinds of work rather than unintentionally overlapping or people on the same kinds of things. And it will also provide our communities with a means to see directly what research is going on and to influence that through a central node. So that's our sort of people who work for the university. The faculty that we support as part of the university also have a number of research projects. And so we have, I think we have 7 federally funded projects right now, ranging from, as I mentioned before, HIV health in Puerto Rico, Alaska Native suicide and community interventions. We have a substance use study grant that's taking place in Minnesota, being done by a faculty member. We have a new study on chronic stress among African Americans in Lincoln, Nebraska by 2 sociology faculty. Telehealth research that's being done by psychology faculty that does sort of Hispanic obesity outreach. These are all faculty-initiated research that we play a supporting role by providing research assistance, by providing grant assistance, funding, advice. We handle contracts, subcontracting a lot of things, and putting those contracts in place so we can do things like genetic testing or for this fascinating project by Bridget Gooseby and Jacob Cheadle in the sociology department are looking at sort of the chronic impact of microaggression, racial aggressions on African Americans. And they're doing it in a very interesting way. They're measuring telomeres, which is the part of your genes that don't, your part of your chromosomes that don't do anything. Mm-hmm. They're the long parts at the end. And stress causes them to shorten, which is the same thing that age does. And what they're looking at are the chronic stresses of the kind of microaggressions that people of color are subject to in the United States. Are these causing premature aging through mm-hmm. stress? A fascinating project. Mm-hmm. So these are faculty-initiated projects that, as an initiative, our role is to incubate, step in, help develop conceptually, and then provide research assistant project management, data protection, and so on as these projects go forward. So we're very excited. I think we'll have 6 or 7 new project launches in the coming year.
Mm-hmm. So not only are your projects sometimes centered here in Nebraska, but they're centered throughout the country, dealing
yes.
with people of color and health disparities that occur.
Absolutely. UNL is a national university, and the issues that concern or that we can learn from span the globe. Mm-hmm. So we have research projects, as we say, in Puerto Rico, Minnesota. I haven't figured out a way to get one in Hawaii yet, but mm-hmm. we're off to Alaska next week. Mm-hmm. And so we go where the issues are that we can learn from, that will help us to create policies and to create programs that can allow us to address problems here in Nebraska and nationwide when we can. That's part of our role. And
that's, again, one of the things that's really unique and kind of which is really very good about this, is that there are implications locally for your research, because we can use it at the Malone Community Center when we are developing programs to combat or to at least prevent some of the health disparities that occur in Lincoln, Nebraska, or here in Nebraska generally.
That's a critical role for the initiative, is the translation component that you're speaking about, which is that researchers often aren't prepared to say exactly how the information that they're getting or the knowledge that they're creating can be translated into direct community policy programs. Mm-hmm. And so we have people on our staff. Our director of research, Devin Crawford, has worked for years as someone who has designed and implemented, along with her mentor, Les Whitbeck, community intervention programs that are being put in place on Native American reservations around the country on diabetes, on suicide prevention, on substance use, young people, old people. And so She is one of the several people on our staff that can do direct translation right down from the science down into the community, and often researchers aren't prepared to build those bridges themselves. We feel like as an initiative that's a role we can play.
At one of our recent community meetings, you presented to us, or your staff presented to us, fact sheets, which I shared with the other directors of our cultural centers here in the city of Lincoln, and we hope to get some feedback to you as to the usefulness of the information and how we can use that in our programming at the Malone Center or the Asian Center or El Centro or the Indian Center. So let me say that that was greatly appreciated, and we're going to give you some feedback on that.
That was one of our purposes in creating the new Community Advisory Board, was so that we could hear what the communities wanted. And that was one of the first things. At our first meeting, people said, well, we could use some direct information. And so we produced a few of those fact sheets, brought them to the next meeting and said, are these right? And people said, yeah, this is kind of what we had in mind also, but what about this, or what about, and that kind of dialogue is essential. So that's what we're shooting for. Exactly.
Let's also talk about where the Minority Health Disparity Initiative is trying to train future public health researchers and also increase a more diverse public health workforce. Maybe you can talk about the efforts that the initiative is doing in that area.
Sure.
With those areas.
So part of it is graduate training and creating a cadre of graduate students who are interested in these minority health projects. Often a project can't afford one whole graduate student. They seem like they're everywhere on campus, but actually they're very expensive. So by the time you pay healthcare and tuition and all those things. So what we're looking to do is try and create a system where graduate students can work across more than one project or with more than one investigator, and that way projects can develop a more a graduate workforce and do the training of graduate students that give them access to multiple perspectives, and at the same time they can afford to have graduate students when maybe they couldn't afford a whole one. They can get a half one. So that's part of it. I mentioned already the REU, which is a really critical educational component. This will be our first year of bringing in undergraduates from across the country to do this 10-week research experience. We had a great luck in establishing a diverse applicant pool, partly because we had minority health in the title, I would imagine. And so I think our total applicant pool was 68% non-traditional students, historically underrepresented groups, and over 70% women. And so, and when I was asked about that, did we specifically target, my response is always that we don't have to, actually. If you set out to create research projects that are of interest to people from historically underrepresented groups and minority communities, you will get those students. They will come because when they hear that their research interests are valid scientific questions, they'll want to be a part of it. And so it's a win-win for us. We don't have to do specific kinds of outreach or targeting, because the topics that we are interested in are themselves magnets for diverse participation, and so we've had great luck in that way. We're really excited about the new group of students that are coming in.
Oh, good. Dr. Dombrowski, we have about 5 minutes left. I want you to touch briefly on Minority Health Disparity Conference that I attended or went to, well, maybe about a month ago. I'm not exactly sure, but you can kind of talk about what went on there and why was it important.
Every year we hold an annual Minority Health Disparities Conference as an initiative. This was our third one. And we try and hold them either here in Lincoln or in Omaha or somewhere in between to try and reach a number of as many different communities as we can. This year we had 85 participants. We had people from 16 community organizations, including healthcare companies, community groups that are providing community access, community health worker groups. So it was great. It was a nice mix of academics. There were some students, faculty from across a number of departments, students from across a number of departments, people from UNMC, from Creighton. And so what we do there is we try and create a lot of information sharing about what's going on in minority health research in Nebraska, and allow people to meet the kinds of collaborators, whether they're community to researcher collaborators, community to community collaborators, or researcher to researcher collaborators that allow them to move forward. We were very lucky to have be able to get a representative from a program officer from NIH's National Institute of Minority Health and Health Disparities, Jennifer Alvarez, who addressed the conference, and then our keynote speaker was Josie Rodriguez from the Nebraska Department of Health and Human Services, who was on your show previously.
Right.
So she gave us a great discussion on what's happening on minority health grant programs throughout the state that perhaps researchers can help with, tie into, learn from, participate in. And it's a very successful conference, so we'll do it again next year.
I tell you what, we could probably have around, I'd say, 2.5 minutes left. And I think you tied into something really that I thought was really important, and that is we had state government there, we had community leaders there, we had the university there, we had folks from Creighton University, UNMC. We had everybody there.
We're trying.
And that's important because
Absolutely.
sometimes you don't know what the left hand is doing and the right hand is doing, and cross purposes. So, and I think it'd be kind of helpful for you to explain to our audience not only that cooperation, collaboration that we're trying to build, but why is this initiative important? Why anybody in Lincoln who's watching this program would say, well, what's the purpose of this initiative and why does it make a difference and why is it needed? Because I think we need to kind of bring that to, quote, what's the purpose?
Absolutely.
Why is it important?
Yeah. It's important because minority health disparities are real.
Right.
And they have a tremendous impact on the lives. When someone is sick, it doesn't just affect them. It affects the people around them. If people are disproportionately sick in some communities than others, then the impact of that reverberates out and can affect the entire community. Our opportunity to address these things now is larger than ever. Minority health disparities have probably been around for as long as the colonial history of the United States has been here. But this is a real chance at this point to address them. And so we feel like we need to take advantage of that situation. And we need to do the work now. We need the knowledge, that we need the practice, we need the implementation that will allow us to create a level playing field on health. And that will allow people to have the personal and individual health to be successful for themselves and for their communities. And this is that time. We really feel like it is.
Okay. Anything else you would like to add about this initiative? Anything else that you would like our audience to know about this initiative?
I think you touched on one of the key points just a moment ago when you said that this is one of those opportunities that we have that bring together so many different communities from Nebraska, from the state to the university to community organizations to populations across to other universities. This is the kind of topic and the kind of project that can build the bridges that can last. And I think that's one of our major goals, is not just to produce nice research careers for university faculty, but to produce an initiative that has at its center the health and well-being of all of us.
Thank you very much. And I like that, the added center of health and well-being of all of us.
Yeah.
Well, that concludes our program today at Health Matters. Again, I thank Dr. Kirk Dombrowski for being with us to discuss the Minority Health Disparity Initiative at the University of Nebraska-Lincoln. Once again, I think he's done a wonderful job of explaining to you and to me something I really didn't know anything about. And once again, I think it's going to teach us the importance of collaboration and using all of our resources to combat and to prevent disparities within our community. That's it for today, and we will see you next time at Health Matters.